So we want to look at several reflexes that could be elicited in the lower limb. Several reflexes that could be elicited in the lower limb. So look at the knee jerk reflex, also known as the patellar reflex. Look at the ankle jerk reflex, also known as the Achilles reflex. We look at the hamstring reflex. We look at the adductor reflex. So about 1, 2, 3, 4, about 4 of them. But all of them, I classify them in the same place because they have to do with the lower limb. Okay, so it could be that I'm commonly trying to look for a particular thing, okay, common to them. So for the knee jerk reflex, also known as the patellar reflex, this is what you do. And the tendon you are trying to strike is the quadriceps tendon, which is at the knee. Okay, so all of them, you should know that you are trying to access the integrity of the spinal cord segment, okay, mostly as related to the lower limb. Okay, so for the knee jerk, also known as the patellar reflex, you are trying to tap the patellar tendon just below the kneecap where the leg is relaxed. So response is we have sudden contraction of the quadriceps, so the leg should kick forward. This is a normal issue, do you understand? But if it is not responding, if the leg is not kicking forward, shows you that there's issue with the femoral nerve and some lumbar spinal cord segments. Okay, then for the Achilles just have to do with this Achilles tendon at the back. Please just pause to observe, right? So for the Achilles tendon reflex, you are trying to tap the Achilles tendon, and this is where the foot, this is when the foot is slightly dorsiflexed. So they should take their foot up a little bit, okay, so that the tendon will show very well. They strike it, smoothly. When there's contraction of the gastrocnemius and the soleus, and the nerves here is what the S1 to S2. Those are the nerves that are trying to pick out. So if it doesn't happen like that, shows you that there's issues or injuries to the tibial nerve. You understand? Then we are looking at the hamstrings reflex. So hamstrings reflex, you are trying to tap the hamstrings tendons. Those are the tendons behind the knee. Okay, so normally there should be contraction of the hamstring muscles. You understand? So those are the nerves L5 to S1. So you are trying to access what the integrity of the sciatic nerve. It's a hamstrings reflex. Then for the adductor reflex, you see, so you are trying to tap the medial thigh near the adductor tendon. So this one shows to the knee, but it's actually what's inside. Do you understand? It's actually inside. So response is usually there's contraction of adductor muscles. So the nerve root you are trying to access there is L2 to L4. So clinical uses, you are trying to test the obturator nerve, the function. So you can have hyperreflexia, you can have hyporeflexia, and so it's actually a quick bedside tool to localize which nerve actually has an issue in an individual.